Hi everyone, this is your Obonge nurse. Yes, so I don't land again today. Thank you guys for subscribing to my YouTube channel. Thank you for putting likes. Thank you for sharing. I am so happy and I am really encouraged. And like I told us that every Mondays and Thursdays I'll be making new videos and I'll be teaching us about some health benefits, how to prevent diseases and prolong life. And today I am here. Last video I told us I was going to talk about stroke and how to manage this patient at home. So I don't learn today, I don't show today. Yes, so don't forget to subscribe. Yes. Now waiting the stroke self. What is stroke? Stroke now when blood supply to the brain don't they interrupted. Now go fit cause stroke. Or when artery for brain don't burst, now go fit cause stroke. And when this thing happen now, the blood supply to the brain don't they reduce. That means the oxygen supply and nutrient supply to the brain don't they reduce. And when this happens, a problem for body. Now go fit cause partial stroke or complete stroke for the whole system. Now wetin dey even cause this stroke? Person go ask Obonge nurse, wetin dey cause stroke? Number one na hypertension fit cause stroke. Diabetes fit cause stroke. Yes. Then again, people wey dey take drug like cocaine, all those stuff, they go fit, you get so many things wey go fit cause stroke. Yeah. So now wetin you go fit do to prevent stroke? Number one, we need to reduce cholesterol level, check our BP from time to time, do exercise, reduce alcohol intake, or you stop am completely. Then you need to stop smoking, reduce stress. Yes, all those things you go fit do and reduce your weight, you go fit prevent stroke. Na me dey tell you. So now person go fit ask say, this stroke get cure? E get cure. E get cure depending on the stage where the stroke don dey or the type of stroke. Na im make immediately wey person wan get stroke, you need to act very fast. Wey be wetin oyibo people dey call be fast. B, balance of this person. Check the person movement, how im dey waka. If the movement don change, you know dey waka normal. Na number one sign. And that thing again na eye of this patient. If the patient no dey see well, or if it be say na you sef, you dey get blood vision, na another sign. And that one again na F. The face of this patient. You go ask the person to smile, you go see say one part of the face now don dey drop. You go already see am say the face one side don dey drop, one side of the face don dey drop. And that one again na wetin the arm. When you tell the person to raise a hand, you go see say one hand no go dey raise well, na another sign. And that one again, speech of this person. You go tell the person to make sentence. This person no go fit make complete sentence. Na sign no. The last one na time. You need to act very fast. 3 hours wey this thing occur, take this person to hospital. No be the time where you go come dey kabash, dey pray. No be that time. That time, no time for that. Take the person to the hospital. After you don take am to the hospital, then dey sure say doctor, the person don start treatment. Then you go fit come kabash zi. Yes, so na so e be. Now wetin you go fit dey do to do wetin to make taking care of this patient dey easier for you? Number one, you need to get help. You no go fit do am alone. No tell me say Obonge, I get all the strength, or because I'm a nurse, or because I'm a doctor, or I'm a superwoman or superman, I go fit do am alone. No, you go dey worn out, or you go dey cut out from the environment. So you need help. You need help. Involve people around you. Caregivers, they get nurses wey dey around, wey dey find work wey go fit pay them. If you no get money, involve family members, grandchildren, everybody, make dem come help you to do this job, because you no go fit do am alone. And that thing again na nutrition of this patient. You need to stick to the nutrition regimen wey the doctor, the nurses, or the nutritionists don give you for hospital. Stick to it and do not overfeed the patient. Do not give this patient too much water. you go just say once you feed am finish, you go carry water pump am. No, you go make this patient to gain weight, and you don't want the patient to gain weight. So you need to stick to that food regimen of the patient, especially those ones wey dey for NG tube, wey don dey use tube to eat. And that thing again na personal hygiene. You need to take personal hygiene very, very serious. So you need to do it to clean this patient very well, this loved one very well, the way wey im go fit do, if to say he or she dey okay, dey healthy, na so you wey go do am. Especially the mouth, oral hygiene dey very, very important to do it to avoid infection. Oral hygiene dey important because any infection for mouth, e dey easy to cross enter heart, and if e enter heart, na more problem, more complication, and you no want that one to happen. Another thing again be say the private part area, you need to clean am very well. If the patient don poo, you need to clean this patient up very well. If you no dey clean this patient up very well, you sef, you go dey see am say the patient no go dey happy. Who go dey happy kwanu with dirty? My brother, my sister, e no dey easy, but I want you to do your best. And that thing again be say na the skin of the patient. After you don baff and finish, try to rub and clean, even if na the Vaseline, so that the skin no go come dey dry and cracky. Yeah. Another thing again na positioning of this patient. Not just leave this patient to lie down for one side for a very long time. No. If you do am, you go develop wetin they call pressure sore, and another problem. So you see all these places where you see, for example, this shoulder wey dey here wey get bone, the buttocks area wey get bone, the heels wey get bone, the toe areas, all these places, once e dey a kind of for so long for bed, you go fit develop pressure. So how you go carry develop be say that place go come dey hot. If e don dey hot now, blood supply to the area go come a kind of reduce. When the blood supply don reduce, the place go come begin to dey dark. You go come begin to dey decay inside. Before you know it, poof, the patient don get wound. You go come start dressing, wound dressing, and you go dey easily affected because this patient dey bedridden, and e no dey feed, feet no dey feed fine. So you see say things don already begin to dey complicate. And that thing again wey go help you avoid this pressure sore be say the bed wey dey lie down, make sure say the bed dey firm. You fit change the bed. If you know say the bed no dey okay, go check that bed now. If you know say that bed no dey okay, check am now as I dey talk to you. No say you go change the bed. If you dress the bed wella, dress am, no allow the bed sheet or the bed to come dey folded. That one too go dey give the patient problem, and e go fit still develop that pressure sore. Yes, na me dey tell you so. Another thing again na wetin wey you go fit do. Medication of the patient, no take am for granted. No come say we go somewhere, they come pray for us, they come say now the whole thing don dey okay, go, you are now healed, or this one, that one, too much story. You go stop to take medication. No. Stick to the medication wey the doctor don prescribe for you. And again, no forget to dey go check up. They go check up from time to time. It is very, very important. And any change wey you wan make sure say you involve your doctor for inside am. No dey do something on your own without involving your caregivers. And that thing again na exercise. E dey very, very important and crucial. You get active exercise, you get passive exercise. Active na the one wey person go fit do by himself without the help of anybody, depending on the condition. Na the person go fit do walking. The person go fit do that one. For the passive exercise, you go help this patient to do exercise. You go help am to dey move a hand from time to time, move am sideways, all those things. Move this arm like this, move am. No ever allow that affected part to dey stiff, to stop, as in without movement. You go leave am without movement. No, if you do am, the brain go totally forget that area. So, but when you dey move this hand now, they move am from time to time. You go do wetin? You go rewire the brain, re-stimulate the brain to begin to dey do the same thing wey im dey do for that hand. You dey get wetin I dey talk? So na im make e dey very, very important to dey do wetin, to dey move am, so that we go a kind of remind the brain wetin im bin dey do before. It is very, very important. And e get wetin dey call physiotherapy. Then get wetin dem myself they go fit do. So if you go hospital, you go talk to your physiotherapist, they go mark for you, then you dey go from time to time. Then for the speech aspect of it, they still get speech therapists. Find anyone wey dey for your area. If you no get, you go fit on your own. Dey talk to this patient. No ever leave this your loved one say, hey, nah, he don dey bedroom, he no dey hear anything. He dey hear. So as you continue to dey talk to am, dey continue to dey talk to am, dey remind am of things, he go start to dey do wetin to dey, he go start to dey recover. He go dey recover. So e dey very very important. Another thing again na diversional therapy. Diversional therapy. You go put something like comedy, you go put movie, no be horror film o, movie dem wey him go like, wey go fit, wey be say if him dey watch, him go dey make am happy. Those ones follow. Music too dey very very important. E dey that music wey him dey like, put am for am. You go see say sometimes him go even try to sing along. And that thing again na if him get grandchildren, call the grandchildren make dem come, as dem dey play around am. That one sef go still dey stimulate am to dey come back small small. And that thing again, be patient. No come talk say, hey, all these things I don do am now, e no dey work. No, you have to continue doing it and be patient. Give your loved one time to recover. Give the brain time to recover, because the brain sef go fit recover. The brain go fit rejuvenate. Yes, so na me dey tell you so. You need time and patience. If you dey do all these things, I dey tell you say taking care of that your loved one go dey easier for you. You sef, you go dey happy. The person wey you dey take care of go dey happy. Thank you very much for watching this video. I really really appreciate. In my next video, I am going to talk about ways to protect our kidney. Ways to protect our kidney in order to avoid kidney diseases and all that. You know, say kidney failure now don dey on the rise, and the treatment, the cost of the treatment, dey very very expensive. So we don't want it to continue growing. So we need to do what? To use preventive measures. So in my next video, I am going to teach you about how you are going to take care of your kidneys. Yeah. Thank you very much for watching. Do not forget to subscribe. Do not forget to hit the like button. If this is your first time of watching my video, this is the best thing you have done, and I am not going to disappoint you. Yes, because every Mondays and Thursdays, I'm going to bring you new videos that you yourself, you will learn something and do what? And save your own life and save the life of others. Thank you very much. God bless you. Thank you for watching. Ciao, ciao, ciao.